I'm Toby Fitzgerald, and I'm going to be doing an academic case study speech related to occupational therapy found in Wiley Blackwell's 2011 Australian Occupational Therapy Journal by Lauren Frame, an occupational therapist at Gold Coast Hospital. In my speech, I will discuss how Mr. C and his occupational therapist come up with a treatment plan for his secondary lymphedema in his right hand. And they also use alternative medicine and compression garments. In Michelle Cameron and Linda Monroe's 2007 book, Physical Rehabilitation, they explain that lymphedema is a buildup of lymph fluid due to damaged or blocked lymphatic vessels. Lymph carries bacteria away from your skin and tissue, and as well as circulating infection-fighting cells throughout your body. 20 years before Mr. C's occupational therapy appointment, he was in a traumatic work accident. He was crushed by a crane and electrocuted. Of course, this caused many injuries. The injuries include thoracic outlet syndrome. On the Healthline website 2018 states, thoracic outlet syndrome refers to a group of conditions that develop when the blood vessels or nerves in the thoracic outlet become compressed. The thoracic outlet is the narrow space between your collarbone down to your first rib. Right ulnar neuropathy, which according to medical writer Naveed Salih's 2020 Very Well Health website, ulnar neuropathy means something's wrong with the ulnar nerve. Right carpal tunnel, as reported in Tyler Wheeler's 2019 WebMD article, carpal tunnel is pressure on your median nerve causing numbness, tingling, or weakness in the hand. Right frozen shoulder, on their website, the Cleveland Clinic 2019 states that frozen shoulder is a painful condition in which the shoulder becomes stiff and inflamed and movement becomes limited. Lymphedema of right hand. This work injury also caused Mr. C to have a stroke, which resulted in right hemiparesis. According to American Stroke Association website 2019, hemiparesis is weakness of one side of the body. Type 1 diabetes, so his body struggles to produce insulin. Ischemic heart disease, according to the American Heart Association website 2015, ischemic heart disease happens when arteries become narrow, causing less blood and oxygen to reach the heart. This disease can cause chest discomfort. Lastly, the stroke also caused high blood pressure and cholesterol. Mr. C has difficulties with everyday tasks such as eating with silverware, dressing himself, especially whenever it comes to buttoning and unbuttoning clothes, and drying himself. Before his occupational therapy appointment, he had already been assessed by neurologists, vascular, and orthopedic surgeons. He has already been treated using physiotherapy, laser, heat, compression glove, massage, and bandaging with some, yet not much success. Mr. C's symptoms included swelling, heaviness, tightness, stiffness, weakness, tingling, limited movement, limited ability to perform everyday tasks, and a 5 out of 10 and 8 out of 10 pain during movement. Observations made by the occupational therapy assistant and occupational therapist included his hands were cold and dry, skin was shiny, his forearm up to his fingers were swollen, top of the hand is tender to the touch, thickened tissue, redness, and numbness. During the first appointment, Mr. C mentioned that he'd like to try alternative and complementary medicine. Because of the lack of success with previous treatments, the occupational therapist believed that Mr. C being more involved in a collaborative plan may bring more success. The occupational therapist didn't have a lot of knowledge or experience with alternative and complementary medicine, so they did a literature review and kind of read about it and created a treatment plan. But also, Mr. C read a book called The Nature Doctor by Alfred Vogel, published in 1952, and it kind of explained how clay reduces swelling And cabbage leaves contain healing properties and draw out toxins as well. Together they can kind of help heal faster. For 2 weeks, Mr. C applied a mixture of clay and 2 tablespoons of rainwater every day around 11 a.m. to 1 p.m. and then at night applied cabbage poultice onto the skin and covered it with cloth and bandaging. After those 2 weeks of using alternative and complementary medicine, Mr. C was fitted for a compression glove that he could only remove during showering or swimming. He also had to do exercises to strengthen his hands. Lastly, to help with handling silverware, they added foam tubing over the handles for an easier grip. At the end of the treatment, Mr. C's results were increased movement in shoulder, elbow, wrist, and hand, improved skin condition, and improved ability to function more with the everyday tasks such as handling silverware.